So today's talk is about blood testing. This thing reminds me of a high chair. I feel like I'm in a high chair. I'm almost a prisoner of whoever's going to be drawing my blood. I can't leave. I can't move. But it's for a reason. If somebody's going to be taking a needle and putting it into your arm, you don't want to be moving around too much. Hopefully you'll get somebody that takes this, puts this big needle on it, and sticks it in with one shot, and then puts in these vacutainers. That's the way it works. With the blood tests we do, usually you'll have one stick and about 3 to 5 containers, and you're done. My suggestion for this lecture would be to talk about TSH, free T3, free T4, those are the thyroid tests that we usually order, and then cortisol. Let's stick with thyroid. I have another talk that I did on thyroid. You might want to review that, but in a nutshell, when people come to see me for what is sounding like an underactive thyroid, that means weight gain, brittle hair, brittle nails, dry skin, fatigue, difficulty with thinking. There's a good chance it could be a thyroid problem, especially if you are a mom. If you've given birth, I think that's a big trauma. Several times, definitely trauma several times. If you've been through a lot of disease, or if you're just getting to the ages of 40, 50, or 60. If the symptoms fit and there's no other problems going on, the likelihood is you have a thyroid problem. If we check the thyroid and there's no cancer, and usually that's with feeling the thyroid and an ultrasound, then sometimes the next step is to see how life would be with iodine, and then after that see how life would be with thyroid hormone. The problem is the medical community is not too friendly with giving hormone of the thyroid that easily. If you look at the OB/GYN community, I can't tell you how many times a young person that I see gets put on birth control pills, those are hormones, without even getting blood tests, without getting a pap smear, without doing any sexual education. That's a disgrace. You should at least, in my opinion, teach somebody about why they might be ovulating the wrong way, maybe which kind of foods to switch over to, what kind of caffeine and grain or sugars to avoid, and then you might do some blood tests after that, maybe some contraception education, and then the oral contraceptives. But I don't see that being done. So the OB/GYNs, I think, some of them will just go ahead and give hormones, estrogen and progesterone, without even doing blood tests. And it's fair enough. If you have the symptoms and there's nothing else going on, that's fine to see how things go. Even in hormonal replacement therapy, not all docs will get FSHs, but bottom line is that in the world of the gynecologists, they don't necessarily get blood tests before they give hormones, okay? So now we have the primary care docs thinking that somebody is hypothyroid and wanting to maybe start a thyroid supplement of some sort. That's usually Synthroid, levothyroid, or Armor, Nature. Sometimes you can get the compounded Leotrix, purely synthetic T3 and T4. Well, I think the primary care guys, primary care doctors are scolded when they give that, thinking that why didn't you do TSH, why did you not do a T3, T4? You have to prove this first before you give it. But yet, in my clinic, they will usually come to me with the blood tests, and I'll say, okay, it looks somewhat abnormal, but not necessarily all off. But your symptoms are all pointing towards hypothyroidism, so give it a try. Try iodine first. I usually try iodine first, about 1 to 3 months. Kelp, in the form of kelp, 50 to 150 micrograms. And if it doesn't provide any relief, then I try a short, small dose of of some kind of thyroid hormone. It's usually going to be a combination of T3, T4. I don't think that the body, if it's not working properly, I don't think the body can convert T4 to T3. That's my opinion, and that's usually what I see when I come in. When I see the patients that come into my office, they're obese, they're fatigued, a little bit of anxiety, problems with sleep, and a whole host of other things. And I just don't think that's a healthy person that I would assume can convert T4 to T3. So thus the reason for the combination of T3, T4 in the form of Armor Nature Thyroid or DrRic. But again, to keep it simple, the bottom line is, do we get blood tests or not? And it's always wise, if a patient has insurance, it's always wise to get a baseline set of blood tests. But listen, if the blood tests are within the normal, and again I mentioned that TSH has a wide range of normal, but yet all the symptoms are pointing towards one disease or another, meaning hypothyroidism, underactive thyroid, or hyperthyroidism, overactive thyroid. If it's hypo or under, it might be worth a little bit of stimulation. Average diet, especially if it's very restrictive, doesn't have iodine in it, so you have to redo some iodine, and that's again in the form of kelp. Or you can take straight iodine, but there are some studies that show that can put somebody into something called a thyroid storm, so you have to be very careful. There are some iodine tests. They're not that great. You can do a urine test for iodine. You can do a spot skin test for iodine. They're okay. I think it's worth it just to try a little bit at a time. To do thyroid hormone, well, if the thyroid is still working, the ultrasound is okay, no nodules, no goiter, then it would be worth a try. Sometimes people can get a little bit of stimulation with thyroid hormone, so you have to go low and slow. Sometimes 3 months before you go to the next dose. So you have to be very patient with this. People want to see doses increased every month, and that can just cause a whole bunch of side effects, and you're not going to know which is the side effect from the medicine, which is the side effect from the disease. So the tests are important. The symptoms are more important, but being taken care of by a doctor who is watching the symptoms, watching the blood tests, and knows the ins and outs of the medicine is the most important. You have to get somebody to listen to you, somebody that's empathetic to know how you feel and what you can do perhaps in the first 3 months to take care of some of the symptoms while you're waiting for the overall result to show. So that's my talk on thyroid disease. You can find a whole host of other talks online. Mercola is pretty decent with what he does, so is Andy Weil. The other part of this is to talk about cortisol. There's this concept in the alternative medicine world called adrenal fatigue. It's not entertained as well in the Western medicine world. My endocrinologists don't really follow that word. They might say adrenal insufficiency, but it usually means that your adrenal cortex, which sits over the kidneys, aren't producing cortisol. It can happen if you've been given steroids for a long amount of time and then suddenly get off the steroids. It can also happen, I believe, if you just have poor sleep, stressed out all the time, no coping skills, no relaxation, and lousy food, a lot of alcohol, too much caffeine. I think all of that does it. I just mentioned the average American. So blood tests are okay. The problem is, when you go in for a blood test to see what your cortisol level is, there's supposed to be high cortisol in the morning and it's supposed to go down as the evening time comes and then stop. Or not stop, but plateau, and then go back up in the morning and then down again as the day goes on. If you have chronic adrenal insufficiency, you'll see that your cortisol is just flat. It doesn't get secreted with spikes, it just stays flat, and that's not healthy. That usually results in fatigue, difficulty of concentration, poor memory, poor problem solving, emotional stability that's not working right. So blood tests would tell, but the problem is, if you go in for a blood test and you're supposed to be relaxed, how are you supposed to relax when you're locked into this and getting a needle stuck into your arm by some stranger and a whole bunch of kids crying that just got their blood taken? It's usually hard to do that. So in that time, unless you're a great meditator or you're one of my yoga students, if you sit there and get your blood tested for the normal low cortisol, your cortisol is going to be jacked up because your fight or flight will be turned on just from getting the blood. So I've been doing cortisol blood tests for a while, and depending on the time of day, I just don't trust them. I'd rather have you do salivary cortisol. Some insurances will cover salivary cortisol, and the places that get them, some places will want only evening cortisols from the saliva, some places will get the morning. It really depends on what I order. If I know where the curve goes, or where the normal curve is supposed to be, and you tell me what time you get the saliva test, I'll be able to put it on the time curve and figure out where you are. DrRic is one of the good companies out there that I think they do take insurance, but they do a 4-time-a-day cortisol level. They give you 4 different tubes, you spit saliva into the tube, and you don't get a stress response from spitting saliva into anything. You get a stress response from having somebody jab you. So I think that doing it at home in your own comfort is good. And you also get a plot of 4 different points throughout a day to kind of let me figure out what your cortisol is doing, what your adrenal cortex is functioning at. I think that's a better way to determine. I mean, again, if you come in totally fatigued, you've been fatigued for years, you have post-traumatic stress disorder, you're taking too much caffeine, you're drinking too much alcohol, you're having poor sleep, the likelihood is I'm going to go ahead and start you on some of the supplements that I use for adrenal fatigue or adrenal insufficiency. And if it gets to be that bad, then we'll do the testing and then we'll put you on steroids. A low dose of methylprednisolone every day seems to bring up the cortisol until you get to a good state where you can produce it on your own. But again, the objective for this talk is whether I like the blood test or the saliva test. I like the saliva test. The only problem is getting it paid for. Some insurances will cover it if it's coded properly, some insurances won't. But what would you rather have? Pay for a blood test that's not going to give the doc any information, or get an accurate test that'll help your provider, your healer, figure out how to get you back into better health?